I think what's happening today is that every union is going to reflect the views of their members. And Unite members have voted to reject the offer that's on the table. And that's what we're going to be sharing with the Staff Council today.
Why do you think that is?
I can't speak for other unions, but what I do know about our members is that they're really angry still about the level of pay that they've been offered. They're really sad that they've come to this place where they're still having to take strike action, where they've had to reject that offer. They're exhausted at how they're trying to keep the NHS being propped up. Shifts are getting dangerous. The work they're being asked to do is more and more, but they're really determined to carry on with that fight.
When was the last time you or the Unite Union spoke to the Health Secretary?
I think that the last time was in those conversations around the pay offer, where he was in the room, but there haven't been any conversations since then, and we really hope that the government can reopen those negotiations. The views of other NHS unions as well as ours will be seen today, but I think it's safe to say that nobody is jumping up and down and saying what a great deal this is for NHS workers. It is way below inflation. Inflation is going to carry on remaining high throughout this year, and NHS staff need better than what is effectively a cut in their cost of living.
In the meantime, strike action is continuing, and for the first time, some critical care services not staffed. Is that sort of action going to continue?
Each union takes a view about what action it takes. Unite has got action going across a number of trusts in England today, including some ambulance trusts, and we'll always have conversations with those trusts directly about what that means and how safety measures can be put in place to protect the public. But ultimately, this is strike action. In order to have an effect, industrial action has to be, stop services, but we don't want to put the public in danger.
It's 50-50 really, isn't it, now, amongst your members? Looking at the latest figures, you may correct me on that, 48% voting in favour of accepting a deal, 52% against. It does look as though support from your members is waning for continued strike action.
I wouldn't say that. What I would say is that members are very angry still. They do want a resolution to this situation. There's no two ways about it. That vote reflects that people really want this to end, but it will only end when the government come up with something that is really reflects the contribution of those NHS workers to our country.
You say that, but we're hearing from the General Secretary of the Royal College of Nurses. They're saying that strikes could go on until Christmas. Do you think that that potentially could be the case with Unite members?
I think that's potentially the case. But as I say, you don't just want to take strike action for the sake of taking strike action. All of us are in the place where we want this ended. Members do not want to be standing on picket lines. They do want to be paid a decent amount of money for the work they do and how they hold the NHS up for all of us. It's only fair and reasonable, but we're going to be fighting until we get that.